I'm going to focus on Cameroon, especially because it is the country that I have been working on for the last 2 years. So I know much better the situation on COVID response in Cameroon than in other countries. So my presentation will just focus on the facts, or how the government, how COVID is affecting Cameroon, how IMF helped in mitigating the economic impact of COVID, and what are the key measures that the authorities are taking to ensure accountability and transparency in the management of COVID money. So next slide. So the situation of the pandemic, the COVID infection has continued to rise since the first case in early March 2020. But at a reduced rate since mid-July. As of now, or as of November 16, the situation over the last 4 days officially has not changed. They were about 22,000 cases, infection cases. 433 people died, and 21,500 recovered. The fatality rate, the case fatality ratio, stand at 1.9, which is relatively low compared to the average African ratio, which is around 2.4. In Cameroon, all regions of Cameroon have been affected, but mostly concentrated in the urban cities, mostly Yaoundé, Douala, and Bafoussam. Now, the problem is that the official numbers are not adjusted for any mistake or non-tested case. For the moment, the population which has been tested is quite low, officially 1.5% of the population. So that's why some caution may be needed. I will come back to that later, but what we did on the IMF side in helping Cameroon is to disburse twice. Cameroon had access to what we call RCF1 and RCF2. RCF1 was obtained in May, and RCF2 was obtained in October. For a total, the total is around, the two is around 385 million US dollar. I come to that later. Now, next slide. Now, the authorities have taken a quite long list of measures to mitigate the impact of COVID. And the key measures are listed on this slide. At the beginning of the pandemic, the exact date is March 17, authorities decided to close the borders, quarantine travelers, close school, universities, prohibit gathering of more than 50 person, limited the number of passengers in public transportation, and so on and so on. Some basically typical measures that have been also taken by many other countries. just to highlight that they took also temporary tax relief to affected businesses through tax moratoria and deferred payment. But also on the social side, they increased the social safety net allocation and adjusted family allowance and pension. At the same time, in parallel, the central bank took a list of measures to ease monetary policy and caution the banking sector. Later in June, the authorities adopted a more comprehensive plan, a 3-year COVID-19 response and recovery plan, which has like 5-6 pillars on which they are going to focus over the 3 years, with a total cost of close to a million, 1,000 million US dollar. And also at the same time, a special dedicated COVID account has been set up. And we think that is now operational. And the government since June has been taking some measures to ease the containment restriction since May. And some of these measures which we had been put in place in March have been just eased for the moment. What to highlight in the case of Cameroon, there was no full containment, contrary to other countries, given the fact that the business environment is quite dominated by the informal sector, and the level of that informal sector in the economy, as the authorities judged that total confinement was very detrimental to the economy and didn't adopt it. Okay, but encouraged social distancing and wearing of masks and so on to lower infection. Next. Now, in terms of economic impact, COVID-19 has impacted tremendously Cameroon economy through 4 channels that are known, not different from many other countries. As a drop in external demand and commodity price, two shocks which affected Cameroon and affected Cameroon through the drop in volume and in value of its exports, and consequently its external account, and also public finance, because part of the government revenue is generated by export of oil. For which the volume and the value, especially the value, declined. Also, the disruption in external trade chain, which affected imports and final goods, importation of intermediate final consumption goods, and that affected production capacity in many sectors. Now we have also the third channel, which is the external financing channel. Although it is now very difficult to measure the exact impact, but as in all countries affected by COVID, generally the remittances and foreign direct investment declined. Now, of course, the anti-COVID measures taken by the authorities affected also domestic demand and domestic supply. notably among these measures, the fact that movement of people and goods were restricted, and also many events, cultural sport events, and also reduction of working hours for a few sectors affected domestic supply and also domestic demand. Next. Now, in numbers term, in terms of in quantitative terms, just we highlight four facts. Now, real GDP growth in 2020 is projected to fall by 7 percentage points of GDP. Basically, for 2020, we are projecting a negative growth of 2.8 compared to a growth rate close to 4% that we were projecting pre-COVID time. Of course, we are projecting a gradual recovery, but that will certainly depend also on how the pandemic is going to be tackled, and also if it will continue worldwide. The current account, of course, was affected. So we are projecting a 2 percentage point effect of the pandemic. And the authorities, hello? The authorities also took some effort, given the drop in revenue, they took effort to reprioritize spending. Okay, so drop in revenue, and also the need to increase some of the transfers, push them to increase the deficit compared to the pre-COVID target. Now, in the banking sector also, weaknesses are apparent and shown by the increased non-performing loans. Next. Now, on globally, what did the IMF? Emergency loans have been approved by the IMF Executive Board at a very record speed. 82 member countries, the last figure that I have, of which 32 from Africa. A total grant of 1.2 billion, of which 16, and also some debt relief were granted to very most poor countries, what we call CCRT, which just granted debt relief for debt service due to IMF over 1 year. But I have to note that some countries are not eligible to IMF financing, and especially the countries with very high debt in a situation of non-sustainability. Now, all the countries which borrowed money from the IMF committed to undertaking governance measures to promote accountable and transparent use of these resources. Next. Now, in the case of Cameroon, the authorities committed in the 2 letters of intent corresponding to RCF1 and RCF2 to assure that funds linked to COVID-19 are subject to transparent and good governance in spending these funds. they committed to issue semi-annual report on COVID-related spending. Now we are waiting for the first one. They committed also to commission an independent audit of the spending and publish it as a result. We are also waiting for that report in mid first semester of 2021, and also to publish the result of public procurement and the beneficial ownership of contracting companies. In granting RCF2 in October, because the authorities have not really met their commitment made in RCF1, prior action, so action to be implemented before they get the money were required. And one of the prior action was to publish all the contracts related to COVID passed between May, early May to October 20 or 21st. And that has been done. And if you go to the website of the Public Procurement Board, you will see all these contracts, including the beneficial ownership of contracting companies. Next. I think I'm going to stop there. I will just highlight the key challenge related to the last slide. The first challenge is on public procurement. Now, because of the nature of COVID, the authorities cannot go through public tendering, appel d'offre, where all the contracts were granted a special market, and that raised an issue because there's no guarantee that contracts were not just distributed to friends or through network. The market force didn't really work through the tendering process. The second challenge is the beneficial ownership. How exactly? So we are asking to publish the beneficial ownership, how to define and how to ensure that behind the contracting company, the named beneficial owner is the true one. That's a challenging issue. There's no way to really to check. So we hope that CSOs will be able to look at the long list of contracts and maybe to come with some kind of assessment evaluation. Now the last challenge. Okay, I stop there.
Fabien, thank you. You have already given us most of the. We let you go through all your slides and those challenges that you are mentioning now. As we didn't have any question in the chat box, so it gave you more time. But I have one question, just one last one question to making sure that we are actually on track on this issue of transparency. So IMF said that countries should keep the receipt. Do you actually have measures in Cameroon to make sure that receipt will be made available to civic society or citizens?
No. I think that kind of statement is not to indicate that countries will show the receipt. Okay? But they will have to report in one way or another, and to be able to report exactly what happened, what kind of market and the beneficial ownership and so on. they need to keep the record of markets that have been passed. So I suppose that the Minister of Health and the Minister of Agriculture have a very accurate way to keep the recording of contracts and also to be able to report accordingly. But
Thank you.
We are not asking the bills. No.
Thank you. But in some countries like South Africa, they have actually decided to keep the receipt totally. And now, thank you, Fabien. We will certainly go to our next panelist. And thank you for that.